Hey everyone, I hope you're all doing good. So this is going to be in continuation to my last videos regarding Plab 2. As I said, I'll make a series of videos on the exam because Plab 2 is a very extensive subject, so I could not cover it in one video. That is why I've made separate videos about the exam. There's one video about the orientation of the exam. Then I made another video about interpersonal skills, and this video is going to be focused solely and primarily on management. So as I've already mentioned, the exam has three domains, that is the history, the interpersonal skills, and the management. And this video is going to be focused solely on the management. So how exactly do you tackle the management part in your Plab 2 exam? Because it has three domains and they're equally marked. People are good in the histories, but they're lacking in their IPS and the management. So I have made separate videos on these two topics. So what exactly is the management and how do you tackle that? That is going to be the subject of this video. So first of all, it is very important that you reach the management stage because the feedback I receive from people who do not do well on the exam is that they do not even reach the management stage. They're lacking on time and they take excellent histories, they're good with the IPS, but they do not reach the management part and the 8-minute bell rings and they have to move on in the circuit. So the first important thing is to at least reach the management stage because that stage is carrying 4 marks and that is the decisive factor in your exam. Then once you reach that stage, you have to cover 5 important domains. And if you do not cover it, if you do not move in a systematic way, you will be haphazard and you will at least, you will lose some marks. So you have to cover 5 domains in management. And what are they? And how do you cover them? So number 1 in your management is your diagnosis. You have to have a right diagnosis or at least some DDs in mind that you tell to the patient. So number 1 would be diagnosis in your management. Number 2 is explanation that carries a mark. So once you have diagnosed something in the patient, you have to explain it to your patient. You have to take your patient on board and explain to them that I'm suspecting that you have this and that is my conclusion, and you have to explain it to your patient. That carries 1 mark. Number 3 is investigations. Many people, they do not talk about this, but it is very important to take your patient in the loop and tell them what you're planning to do. So number 3 is investigations. All right, Mr. XYZ, I have reached this conclusion. I'm suspecting that you have this. Do you have any idea what that is? Even if the patient says, yes, I do know a bit about it, you carry on with the explanation. You, in very simple words, in a layman language, you explain to them that this disease XYZ, it means that this is going on with you, and that is what we're suspecting that's wrong. So you have to explain it to them, and then you have to tell them that I'm suspecting this, but we will be confirming this through a series of investigations. And then you talk about investigations because that carries a mark in your management. So, and investigations, mind you, don't just talk generically, don't talk very generally. You have to mention a specific set of investigations that you will be conducting that is disease specific and disease oriented. You don't mention 10 investigations and hope that you'll get a mark. You don't. You have to be disease specific, disease oriented, and that is how you talk about investigations in your management. Number 4 is your treatment. Right? And in treatment, again, you have to talk about 2 things. Number 1 is the symptomatic treatment. First of all, if you are, running short of time, you talk about the symptomatic management. If the patient presented with pain, you talk about painkillers. If the patient presented with fever, you talk about antipyretics. So first of all is the symptomatic treatment. How do you relieve the symptom that the patient presented with? That is, very important. So number 1 would be the symptomatic treatment, and number 2 would be the underlying treatment. So, once you have relieved the patient's symptoms, whatever they were, for example, fever, vomiting, diarrhea, abdominal pain, whatever, any of these symptoms that the patient presented with, you have to relieve them. And once you have relieved the symptoms, you talk about the underlying treatment that you will do after confirming the diagnosis through your specific set of investigations. That is how you approach, and that is how you move on with your management. And number 5 is support. It is very important that you talk about support. If it's a chronic disease, you have to offer some support, some help, some psychological support if the patient needs that. If it's an acute disease, even then you offer support. So number 5 in your management would be to quickly talk about support, that whatever you need, whatever help, assistance you want, we are here for you, and we are trying our best to help you in the best possible way that we can. That is how you move on with the management, and if you follow this pattern, you will surely get very good marks. So I hope that helped, and all the best.